Hi, it's Dr. Sweeney. I'd like to talk about memory problems and dementia today. It's a difficult subject to talk about. A lot of people present to the family doctor, the general practitioner, with concerns about their memory, often about their short-term memory failing. Sometimes these patients can be older, sometimes younger. And it's really important that if you are having concerns about memory problems, that you should check in with your doctor or healthcare provider as soon as possible, because it's really important to try and identify why you might be having these memory issues, because a lot of the time the diagnosis that it results in can be something that can be reversible or treatable. Now, often when people come with regard to memory problems, the healthcare professionals should do some kind of scoring system where they can ask you different questions that check out all the different cognitive functions within the brain, check out your orientation in time and place, etc. Blood tests are always run because there's a few common things that can cause cognitive impairment, that's memory impairment: diabetes, vitamin B12 or folate deficiency, anemia, thyroid problems. We also check routinely kidney and liver function as well. So all these things are checked when we're assessing someone's memory. We're checking for signs of infection as well. And also it's commonplace to get a brain scan to assess whether there's any structural changes to the brain, any tumours, any growths, any shrinkage of the brain, what we call cerebral atrophy. And so a combination of scoring systems, questions, blood tests, brain scans can help us reach a diagnosis of what might be behind this memory problem. Now, a lot of people are generally concerned about dementia. Now, dementia as a disease process can be the result of a number of other diseases. So one of the most common types of dementia is Alzheimer's dementia, where you can get little protein deposits in the brain. There's also something called vascular dementia, which is when essentially the brain suffers mini strokes, and this can damage parts of the brain. It can be a bit more aggressive and can progress in a stepwise manner, often changing the characteristics of a person as well. There are more rare forms that can be, that can cause dementia also, but they are two of the more common types that we see. Now, what's the benefit of having a diagnosis is that there are treatments called cognitive enhancers, a type of medication, either in tablet or patch form, that can be prescribed that can give a temporary improvement in certain types of dementia if and when it's diagnosed. So there is a benefit, and also just to understand about people's capacity to make decisions and keeping them safe going forward in the future. So there's a lot to be gained from having this checked out. A lot of younger people often present with apparent memory problems, and often the cognitive tests are normal, blood tests are normal, brain scan can be normal. And actually, one of the most common causes of apparent memory problems is actually anxiety and depression. So if we're feeling very stressed, anxious and down, that can actually mean that we don't really take in information as it happens. And so we apparently struggle to recall things when we want to. So actually, one of the more common causes of memory loss in younger people is actually mental health problems such as anxiety and depression. Again, something that you should go and speak to your doctor about to get that checked out and treated, because that can be very much treated as well. But I hope that's been helpful, and just encourage either yourself if you're having problems or someone in your family to start that difficult conversation if you've noticed a change in them, to go and be assessed to get to the bottom of what's happening sooner rather than later. Thanks for listening, and until next time, see you soon.